During COVID pandemic, very few appointments were face-to-face with doctors. People were advised not to attend hospital due to the risk of getting exposed to this deadly virus. In this video, we will talk about medical items that I think are necessary for every household. If these items are used correctly, they can not only give you the confidence to understand your health, but also will help the doctors to make decisions during a remote consultation. Let's have a look. Hey, welcome to my channel. My name is Dr. Hashmi. I am working as a junior doctor in the NHS UK. If you are new to the channel, hit the subscribe button for health related topics and juicy life curiosities. So number one in our list is this nice looking square box. Actually, this is called a pulse oximeter. This is a wonderful device that tells us the oxygen concentration in our blood and our heart rate. It is quite easy to use. It is portable and it operates on a battery. We can say that this device is actually the backbone of a medical ward. During pandemic, all COVID related decisions were actually based on oxygen levels. This is quite easy to use and it is not very expensive as well. All you have to do is to turn on the device, look for a light inside it and place your finger against that light. It will take few seconds and then you will see some numbers on the screen. The number with percentage is actually the oxygen concentration in your blood and the other number shows the heart rate. Normally, in a healthy individual, we would expect oxygen concentration of 94 and above. If your oxygen concentration is below normal, try using it on another finger. If it still comes low, you will have to talk to your doctor. I'm afraid there is no other choice. If you have an elderly parent living with you with some lung conditions and you need a device to monitor if they are okay, so I think this is the best device. Sometimes people also use this device to monitor their heart rate if they get palpitations. This device gives confidence in understanding serious condition and helps your doctor making a decision if you're having a remote consultation. Having said that, this is a cheap gadget, definitely worth buying. Keep one thing in mind, that there are different pulse oximeters for children and a certain level of expertise is required to accurately check oxygen levels in children. If you're looking after an unwell child, do not waste your time on pulse oximeter, just get help from your doctor. Glucometer. This fancy looking device is to check blood sugar in your body. This is particularly important if you have someone who has diabetes or you are looking after an elderly parent with comorbidities, especially if their diet and fluids intake is not great. You would not believe that how frequently this test is done in hospital for a number of reasons. Confused patients, agitated patients, lethargic, drowsy, sleepy and unconscious patients, because low blood sugar, aka hypoglycemia, is very common and it can lead to all mentioned problems. Children are also prone to have low blood sugar and sometimes it can be a sign of a severe infection. Having this device at home can add a lot of value. On the other hand, if you are perfectly healthy, again this is an amazing monitoring device, and if your blood sugars are consistently high, then that could help in early diagnosis of diabetes, and everybody knows that early diagnosis and treatment can prevent further complications. This is quite easy. All you have to do is to attach this strip with the device. Some numbers will appear. Then you have to use this fancy needle. You just need 1 drop of blood to have these values. Normal blood sugar levels, they vary, but in UK we use these values. This device can be bought for 20 to 25 pounds and it's really easy to use. However, if you are a proper needle phobic person, then this might not be a good idea for you. A wooden spatula, more precisely a wooden tongue depressor. Name pretty much defines it. It can do amazing things and can save you from attending your doctor or taking time off. Doctor always use this to have a look inside inside our mouth to look for ulcers, red and inflamed back of the throat, aka postpharyngeal wall, and tonsils. Again, it is very easy to use. You can use it in front of a mirror, or someone at home can do it for you and also take some pictures, which can be emailed to your doctor. And here we go. You got the diagnosis and prescription on your way back to home. Keep a couple of things in mind. This advice is only for minor illness. If you think that you're really unwell, then there is no replacement for a proper expert opinion. These spatulas can be bought in bulk, 100 pieces for like £2 or £3 online. Use and throw, simple and easy peasy. Do not try to use it if you don't feel comfortable, especially on a child who might not cooperate, and also if the child had something stuck in its mouth, chances are it might get pushed ahead, so be careful. Now, believe or not, number 4 is a paracetamol. Yes, simple paracetamol, queen of the north. Actually, this is true for all pains. Most of the doctors would ask if you had already tried paracetamol. It is simple, easy. Normally for an average person, it is about 1 gram 4 times a day. But if your body weight is less than 50 kilogram, those may be different or half. So check with your pharmacist. Okay, number 5 is a blood pressure monitor that measures blood pressure. It is commonly used and it is the bread and butter of medical profession. Now, it is advised to monitor your blood pressure even if you're healthy, because it helps with early diagnosis of hypertension, which is a condition when blood pressure is constantly high, because early diagnosis can help in early treatment, prevention, and ultimately it saves you from complications. Normally, it is also a good habit to know your own parameters, because I am quite fond of knowing my own heart rate, blood pressure, oxygen saturations, and temperatures in health and sickness, because it just gives me this feeling and sense of control in my life. Most of the times, doctors do home blood pressure monitoring for people to make a diagnosis of hypertension. It can save you from hassle of attending surgery, paying a deposit to get a blood pressure apparatus. It is also commonly used for people who complain of being dizzy or they fall a lot, and in particular if there was a difference in their blood pressure when they lie down and stand up. Last but not the least, this could be very helpful for people who are on blood pressure medications. There are many types, but thanks to technology, digital and automatic is the way to go. On average, it costs about 20 to 25 pounds, but can be very expensive depending on the brand. But this would be a huge investment from your health budget. I would definitely recommend a thermometer. Everybody knows, and most of us already have this at home, especially if you have children in house. Children get fever all the time. Having one of this boy at home would definitely help monitor the severity of problem. In children, most of the infections are viral in nature, but sometimes high temperature can cause fits, aka febrile convulsions. Again, if it happens, bother your doctor. They are there for you. Prices vary. There are many types. My personal favorite is non-contact infrared thermometer. Costs around 30 to 35 pound. I like them because they are easy to use and they are contact free. So it means they can be used for all members of the household. You may also find some other gadgets looking like this in market, but they are not as easy to use as this one. Honestly, I don't like this device with earpieces, because whenever I try to check temperature of my patients with one of these, this earpiece would always stuck in patients' ears, and that's annoying and it's really embarrassing. Next in our list is a fat measuring calipers. It is really a simple way of knowing fat in your body. In my opinion, body weight is not a very good indicator of health overall. I will make a separate video just on this concept, that how we should measure fat contents in our body instead of following weight. So stay tuned and subscribe if you have already not done it. I want to quickly talk about fatty liver disease, also known as non-alcoholic fatty liver disease. According to data, there were 500 million new cases in the last 3 decades worldwide. And if you read literature, you will know that this is common even if you have normal body weight and BMI. Strange, right? In my opinion, it is common in thin people because they expect at least and continue their high calorie tasty diets. And there are some other reasons which are beyond the scope of this video. It is easily available online and it is super easy to use. Now the next in our list is a urine dipstick and a white top bottle. This is not a mandatory item, but it can be very useful and it can save your time and of your doctor. The amount of information it gives is just awesome and it is quite simple to use. It is used in diagnosing urine infections, blood in urine, protein in urine and sugar in urine. All of these are related to many kidney or urinary tract related problems both in children and adults, especially elderly. It can also prevent you from physically going to the doctor. You can discuss the result of your tests with your doctor. They might ask you some related questions, but I'm sure that they will be thankful to you for doing this test at home. Last one in our list is a measuring tape. This is very common and important, and I'm sure that most of the households will already have it. Actually, doctors use measuring tape in order to diagnose clots in legs, also known as deep vein thrombosis. Most common symptoms are usually a swollen leg and pain compared to the other leg. Now you must be thinking, why should I have this tape and why should I get involved in diagnosing clots in my legs? Well, most of the primary practices in UK do not have a blood test and an ultrasound scan to confirm the diagnosis of clot. In the UK, the steps would be: attend your primary practice where doctor will measure your leg, make a provisional diagnosis and will refer you to hospital. Then you will attend an appointment in hospital for ultrasound scan and a blood test which will confirm if you have clot or not. Now if you are able to measure your calf's diameter at home with the help of this measuring tape, it can save you from going to your primary doctor. You can just have a remote consultation. He or she should be able to refer you to hospital without actually seeing you physically. And let's not forget that it is also used in measuring other problems like swellings, bruises, moles and ulcers and many more like this. I hope this was helpful. If you found this information valuable, share it with others, like the video and mention your thoughts in the comment section below. Subscribe to the channel for upcoming medical nuggets. Till then, have fun and stay healthy. Bye bye.